Hello and welcome. Today we're delving into the world of rare neurological disorders, focusing on a particularly challenging condition called Zellweger syndrome. Zellweger syndrome, also known as cerebropatornal syndrome, is a genetic disorder. It's primarily caused by mutations in genes responsible for the normal function of peroxisomes. Peroxisomes are tiny compartments within our cells that perform critical metabolic tasks. Specifically, mutations in genes like POC, PEX2, PEX, PEX3, and others disrupt the import of essential enzymes into peroxisomes. Since these mutations are recessive, both parents must carry the faulty gene for a child to inherit the condition. Now let's discuss the underlying mechanisms. Because of the impaired peroxisomal function, very long-chain fatty acids, or VLCFAs, and other harmful substances accumulate in the body. This buildup leads to damage in various organs, including the brain, liver, and kidneys. Moreover, the lack of functional peroxisomes hinders the synthesis of crucial substances like plasmalogens, essential for brain development and myelin formation, further contributing to neurological problems. Zellweger syndrome is a rare disease. It's estimated to occur in approximately 1 in 50,000 to 100,000 newborns. Because it's a genetic disorder, the incidence is generally consistent across different populations. However, regions with higher rates of consanguinity, or marriage between close relatives, may see a slightly increased prevalence. The signs and symptoms of Zellweger syndrome can be quite variable, but they typically manifest shortly after birth. Common features include distinctive facial features such as a high forehead, a flattened face, and widely spaced eyes. Babies may also have profound hypotonia, or poor muscle tone, seizures, feeding difficulties, liver dysfunction, and visual and hearing impairments. In severe cases, there can be skeletal abnormalities and kidney cysts. Diagnosis usually begins with a clinical evaluation. Considering the characteristic symptoms, doctors will typically order blood tests to measure the levels of VLCFAs. Elevated levels are a strong indicator of Zellweger syndrome. Genetic testing to identify the specific gene mutation can confirm the diagnosis. Furthermore, imaging studies, such as MRI of the brain, can help assess the extent of neurological involvement. Zellweger spectrum disorders include Zellweger syndrome, neonatal adrenoleukodystrophy (NALD), and infantile refsum disease (IRD). These conditions represent a continuum of severity, with Zellweger syndrome being the most severe, and IRD generally being the mildest. They all arise from similar underlying defects in peroxisome biogenesis. Currently, there is no cure for Zellweger syndrome. Treatment focuses on managing symptoms and providing supportive care. This may include nutritional support, medications to control seizures, physical therapy to improve muscle tone, and interventions to address visual and hearing impairments. Liver transplantation may be considered in some cases of severe liver dysfunction. Since Zellweger syndrome is a genetic disorder, there's no way to directly prevent it. However, genetic counseling is highly recommended for couples with a family history of the disease or who are known carriers of the mutated gene. Prenatal testing, such as chorionic villus sampling or amniocentesis, can be performed to determine if the fetus is affected. The prognosis for individuals with Zellweger syndrome is generally poor. The majority of infants with the severe form of the disorder do not survive beyond their first year of life. Those with milder forms may live longer, but they typically experience significant developmental delays and health problems. Recent research efforts are focusing on developing gene therapy approaches to correct the underlying genetic defect. Other research is exploring the potential of chaperone therapies to stabilize the misfolded proteins resulting from the gene mutations, thereby improving peroxisomal function. While these approaches are still in early stages, they offer hope for future treatments. Thank you for joining me on this exploration of Zellweger syndrome.